Okay, this little dog just arrived at the surgery after being in a fight with another dog, and he's suffering from an acute severe injury of the left eye. Basically, this condition is called proptosis of the eye bulb, and it means dislocation of the eyeball with the eyeball that literally comes out the normal location and needs to be pushed back in place to try to save the eye and to try to reduce the possible secondary infection and the blindness that the dog could actually suffer from due to a damage to the optic nerve that has been probably stretched during the trauma. The procedure involves pushing after cleaning the eyeball, pushing the eyeball back into position and place some suture material to literally close the eyelids and leave the eye in position, the eyeball in position for 3 weeks, and then see again the dog in 3 weeks time to first of all make sure that the eye doesn't dislocate anymore, and then to assess his sight and so make sure that the eye doesn't go blind. Worst case scenario, if this condition is left untreated for even for hours, the dog could risk the enucleation, so the surgical basically extraction of the eyeball, and he could definitely lose the eyeball completely. So the next step would be to place some suture material to close the eyelids and try to to keep the eye back in place. So what I'm going to do is literally stitch in, going through the lower eyelid, and then stitch this one together with the upper one. We're going to keep the eye closed. The idea is to keep the eye closed for 3 weeks. And the healing process should help to anchor the eye to the bottom of the cavity where the eye is supposed to stay in. Okay, so now we've got the suture material in place. Now we need to push the eye back in and try to close the eyelids together. Yeah. And basically what we're going to do now is the eye is gone back in place. As you can see, we're going to stitch all these suture material together to keep the eye closed and the eyeball in place. In 3 weeks time we'll repeat a quick anesthetic, we'll take the stitches out, and we'll assess the condition of the eye bulb, and then we'll decide if the dog will require further surgery, or if the surgery we've done today will be enough to sort this and to cure and treat this problem. Okay, the surgical procedure is now over. The stitches are in place. The eyeball is contained by the 2 eyelids. We're going to reassess the eye in 3 weeks time. We're going to reassess the dog in 3 days, monitoring him for pain, possible secondary infections, and depending on how quickly the dog will recover from the anesthetic and depending on the pain, we'll decide if he will be ready to go home straight away today, or if we'll stay hospitalized for a night on painkillers with us. Okay, so it has been 3 weeks since the last video when we put the eye back in position and we stitched up the eyelids, and today the dog is back for re-examination, and unfortunately after removing the suture material we've seen that the eye is dramatically compromised. So basically what happened, we got a really big corneal ulcer. There's no healing, and it's probably due to a secondary bacterial infection after the fight he had 3 weeks ago. But also the problem is that the eye is not responding to the light stimulation. The swelling has not gone down completely, and so the eye is chronically swollen and bigger than the right one, and unfortunately it can't be saved. So the next step unfortunately will be to remove the eye completely and stitch up the eyelids. His quality of life will be excellent anyway, and the dog will go back on his normal activity within the next 12 to 14 days. Hi everyone, we have little Rodney here back for follow-up check 6 days after the surgery. And first of all, this little one looks very comfortable. He's a lot happier than he was before. Also because now the source of the infection has been completely removed. The wound is healing really well. There is no discharge from his surgical wound at all. He's still on tablets, he's still on antibiotics and anti-inflammatories, and he's still got another couple of days left of them. But he's very comfortable. I'm happy with the way he's doing. He has to keep the buster collar on because, of course, the healing process will make his eye a little bit itchy, and he will probably try to scratch his eye a little bit. And the stitches are dissolvable. I don't think that we're going to plan to remove them. Probably they're going to stay there until they completely disappear. So the plan for now is just to finish the course of tablets and go back to the normal routine and normal activity.